Uterine fibroids. Definition. Uterine fibroids are extremely common benign neoplasms of the uterus. The lifetime prevalence of fibroids exceeds 80% among black women and approaches 70% among white women. In a study using ultrasonographic screening, 51% of premenopausal women received a new diagnosis of fibroids. A video about what is a uterine fibroids myoma symptom and how to shrink uterine fibroids.
Mainly consists of muscular tissue and usually grows inside the uterus. Fibroids are also called myomas. Its size ranges widely from a small tumour the size of a pea to a large tumour almost the size of the uterus. Myomas are classified into 3 types depending on the location where they're found. The intramural myoma, a fibroid that grows in the muscular wall of the uterus. The subserosal myoma, a fibroid located just beneath the outside mucosal covering of the uterus. Here, the fibroid projects to the outside and occasionally remains connected with the uterus only through a small stalk. The submucosal myoma.
Application on medicine. Fibroids can cause heavy or prolonged menstrual bleeding and resultant anemia in women of reproductive age. Fibroid-related bleeding can also occur in postmenopausal women, but bleeding in this population should prompt evaluation for more worrisome causes of this symptom, including endometrial hyperplasia and carcinoma. Large fibroids and an enlarged uterus can also result in bulk symptoms, including bowel and bladder dysfunction and abdominal protrusion. Painful menses, non-cycling, pelvic pain, infertility, and recurrent miscarriage can also be symptoms of fibroids, but many fibroids remain asymptomatic. A video about uterine fibroids removal.
Attempts at a hysteroscopic resection. The hysterotomy is performed using monopolar. The fibroid is grasped with a single-tooth tenaculum and elevated. The first of which is running along the again using
the pros. Uterine fibroids are common in women of reproductive age. They are particularly prevalent among black women and are more often associated with severe symptoms in black women than in white women. Hysterectomy provides the most effective treatment for fibroids and eliminates the risk of new fibroid formation, but it is not acceptable to many women and is often more invasive than alternative treatments. The choice among uterine sparing options is guided by the size, number, and location of fibroids. The woman's symptoms are where she is her reproductive lifespan. In women with symptoms related to leiomyoma bulk interventional treatments, there are alternatives to hysterectomy, including myomectomy. Uterine artery embolization, focused ultrasound surgery, and radiofrequency ablation. The cons. Increasing age up to menopause and black rice are the major risk factor from fibroids. The rate of hospitalization in which fibroids is a dysgeric diagnosis is approximately 3 times as high as the rate of uterine sparing. Myomectomy is nearly 7 times as high among black women as among white women. Black women also report significantly more severe fibroid symptoms and more impairment of daily activities. Both reproductive and environmental factors influence the risk of fibroids. Increasing parity is associated with a decreased risk, possibly through elimination of incipient fibroids as the uterus involuntes for postpartum. Video about uterine fibroids, a common symptom of fibroids in the uterus.
Uterine fibroids are very common in women of childbearing age, but most don't even know they have them, as the symptoms of fibroids can easily be mistaken for something else. In fact, 50% of women with fibroids have no symptoms at all, and only know they have fibroids during a pelvic exam or when they're having troubles conceiving. Here are some of the more common symptoms you need to be aware of, so you know when it's time to take action. Abdominal swelling or nighttime sanitary towels during your period or blood. Vaginal bleeding after menopause are located quite near the nerves for the
Another video about uterine fibroids treatment.
Uterine Fibroids Cure Program written by a nutritionist and a health consultant. Her name is Amanda Lido. Amanda has the incredible ability to cut through all the BS and hype that surrounds curing fibroids and their related symptoms.
Do you want to learn how to cure your uterine fibroids and their related symptoms from someone who has heard from the person who's actually done what I'm trying to do? If you're trying to cure your PCOS or battling with any type of uterine fibroids, you must check this out. I don't endorse many products, mainly because they are mostly hype and don't live up to expectation. Amanda's new book called Fibroids Miracle is an exception. This material is excellent and a must-read for anyone trying to cure uterine fibroids and dramatically improve their health and well-being.
Isuet applet in Ecuador. Treatment depends on the desire to conserve the uterus and fertility. Over the years, open surgeries like abdominal hysterectomy is considered over-treatment, and even if for some reason you have to remove, it is preferred hysterectomy laparoscope long as the patient quite live. For this such as not present many adhesion from previous surgeries. Surgery is conservative myomectomy, removing only the fibroid which can be open or laparoscopic. When presented submucosal fibroids, myomectomy, conventional or laparoscopic leave scars in the uterine wall, generating potential disadvantage for future pregnancies. Conclusion. The woman in the vintage has symptomatic fibroids that warrant intervention. Because she does not wish to become pregnant, hysterectomy with ovarian conservation is an option, but alternatives to hysterectomy should also be discussed. Given her symptom related to leiomyoma, bulk in addition to heavy menstrual bleeding, as well as her multiple fibroids and modest uterine enlargement, I would recommend embolization-focused ultrasound surgery of radiofrequency ablation if available. Although there are no data from randomized trials to compare options, these procedures are, as compared with hysterectomy, would be anticipated to result in rapid recovery and low risk of complication.